Hello, and welcome everybody to the National Trends in Disability Employment,
or nTIDE,
Lunch and Learn series.
Just a few housekeeping items before we begin.
This webinar is being recorded.
We will post an archive of each webinar each month on our website at www.researchondisability.org/nTIDE.
This site will also provide copies of the presentations, the speakers' bios, full transcripts, and other valuable resources.
As an attendee of this webinar, you are a viewer.
To ask questions of the speakers, click on the Q&A box on your webinar screen and type your questions into the box.
Speakers will review these questions and provide answers during the last section of the webinar.
Some questions may be answered directly in the Q&A box.
If you have any questions following this recording, please contact us at disability.statistics@unh.edu
or toll free at 866-538-9521 for more information.
Thanks for joining us.
Enjoy today's webinar.
Hi everybody, this is Andrew Houghtonville from the University of New Hampshire Institute on Disability with today's nTIDE Lunch and Learn. The Lunch and Learn occurs every first Friday for the most part at noon Eastern Time, and we release the nTIDE report. The Lunch and Learn is a joint effort of the University of New Hampshire, Kessler Foundation, and the Association of University Centers, Association of University Centers on Disability. And nTIDE Lunch and Learn is a part of the Rehabilitation Research and Training Center on Disability on Employment Policy and Measurement, which is funded by NIDE. As always, we have three parts and then a Q&A session. John O'Neill at Kessler Foundation, and I will report the results. Denise Rozelle from AUCD will talk about the news, the latest news, and legislative issues and things that are occurring. And then we have our guest speakers, Katie Morrison and Yanni Ben Salom from Mathematical Policy Research, who are, please raise my voice. Okay, thank you, Art. And I will raise my voice. And so we'll have two guest speakers, Katie Morrison and Yanni Ben Salom from Mathematical Policy Research, who will be talking about some of their research they've been doing with regard to employers, and then we'll have a Q&A session. This is one of the few times we've had employer-related research, so it's fun to hear some of the latest results. Oops. Okay, John O'Neill, take it away.
Thank you, Andrew. Good day, everybody. The monthly nTIDE report is a press release and an infographic that looks at the latest employment statistics. We use data from the jobs report, which is released, as Andrew said, usually every first Friday of each month. It's released by the U.S. Bureau of Labor Statistics, and nTIDE, as Andrew had mentioned, is a joint effort between the Kessler Foundation and the University of New Hampshire. Next slide, please. The data source. We use the current population survey. It's the source for the official unemployment rate. It includes data, or our customized data includes civilians aged 16 to 64 who are not living in institutions, and it has the information has been available since September of 2008 onward. That was when the 6 disability questions were added to the various surveys that the federal government conducts. The data is not yet seasonally adjusted, and that is why we compare the results of the current month to the same month last year. Next slide, please.
All right.
And Andrew, I'll hand it back to you.
All right, thank you, John. All right, so the numbers. So the employment to population ratio, the percentage that are employed, went down slightly for people with disabilities. down 0.4 percentage points, and that's about 1.3%. The employment to population ratio for people without disabilities actually went up a little bit, 0.6 of a percentage point, and that's around 8% for people without disabilities. So not a lot of action compared to this time last year. And for labor force participation rate, so this is the percentage of the population that is either working or actively looking for work. Very similar, but you're adding the percentage that's looking for work, actively looking for work in the last 4 weeks. And so that went down slightly for people with disabilities. It went down 0.7 of a percentage point, and that's up down 2.1%. And then for people without disabilities, it went up slightly from 0.1 points, or 0.1%. So a really, really negligible amount. And so really this is kind of telling us, if we look over the last 3 months, this is what our third month of consecutive decline. So I hope people are able to view this graph. The last 3 months, 4 months, we've had a decline. And if you take out the peak, what would that peak have been in March? This actually period is kind of declining and stagnant. Again, that's after 2 years of almost increases compared to this time last year. So we've had a pretty good run. For people without disabilities, you can see this kind of slow march upward. If you can kind of see the seasonality coming in this time series. And so we see a slight increase keep going up for people without disabilities. And so this is a bit of bad news. 3 months, of very modest declines. It's not a trend, but it really does suggest that the pattern that we saw is slowing down a bit. But 3 months doesn't make a time trend. So we'll see what happens in the coming months. It'll be interesting to see. You can kind of see in the next slide, or we'll snap a time trend into this, and you can kind of see that tapering off. That the line goes past the point of July. I wouldn't take that as a prediction. But if I had to guess, I would say that it's flattening out. In any event. So that's the news in terms of the numbers. Now I'll turn it over to Denise. We'll do Q&A after if you have questions about the unemployment, the labor force participation rate or employment rate trend. But for now, I'll turn it over to Denise for other news. So Denise, take it over.
Thanks so much, Andrew. Next slide. So let's do some federal policy. Couple of things. Last month, we talked about the Perkins Career and Technical Assistance Reauthorization. Perkins is CTE. As I said to you last month, it had passed, I believe last month that it passed the Senate, but not the House yet. In any case, it's passed both, and the president signed it this week. You might have seen some of the hoopla about it. The important thing for us to know about Perkins, and I think I said this to you all last month as well, Perkins has always been available to people with disabilities. It's just not been highlighted particularly. And there's some really nice language in this new bill, this new now law, that highlights people with disabilities. We're in the purpose statement. It gives a very nice definition of universal design for learning and talks about that as being an evidence-based practice. There are a variety of places where disability is called out. So the hope is that this will make it easier for those of you who work with this population to work with community colleges and other kinds of career and technical education, other kinds of Perkins programs to include people with disabilities. It gives you some things to hang your hat on. And it's really exciting. So we're thrilled to see that. And there's some money in it. I'm not saying specifically for people with disabilities, but there is some money in it. And we're certainly one of the special populations. And so you may be able to hang your hat on that as well. Appropriations, we talk about this every month, but it's moving along. Interestingly enough, it's moving along more regular order than we have seen in the last several years. So we're keeping an eye on it. We may actually have appropriations finished by the end of September, as it should be. If not, I'm sure it'll get done in, well, I'm not sure of anything, but I'm fairly certain it'll get done in the lame duck. Numbers look good. There's not a lot of cuts. There are some increases. So you should feel good about that. The ABLE Act, I'm not sure I've talked on this call about this, but there is some legislation out there. It's Senate Bill 817 and House Bill 1874 that are looking to, they're called the ABLE Age Adjustment Act. And the idea is, for those of you who remember or have been watching ABLE, ABLE said that you could open this ABLE account, money that could be kind of like a 529 account that could be used for a variety of disability purposes. If you had your disability, you acquired your disability at age 26 or before. We tried to go higher than that when the bill passed, but the numbers for the costs were just too high. So there's now new legislation out there that there's been a big push to get co-sponsors for. So if you've seen it recently, that's why. And it would raise the age. So if you acquire your disability by age 46, you would be able to do an ABLE account. We're hoping that that might move. There's some thought it might move before the end of the lame duck, at least. It's something that people are interested in, and there's some bipartisan interest. So keep your eye on it, but also if you might want to check and see if your member of Congress has co-sponsored either of the bills, and if they haven't, ask them to. It's not a heavy lift for them. It's not that expensive, and there's bipartisan support. So if you're interested, I'd go look at that one. Supreme Court nominations. I raised this last month, and now I actually have some news. As I'm sure you know, Justice Kennedy has resigned from the Supreme Court, and there's a nominee, Judge Brett Kavanaugh. A number of disability organizations in this last week, led by AUCD, came out in opposition to Judge Kavanaugh. And the reason that we did that, we from AUCD, is based on some very specific disability cases. In the first place, he has opposed the ACA and has ruled to overturn it. That's one piece. But on disability issues, there is an opinion out of the DC Circuit where he wrote the opinion, where basically they overturned a series of lower court opinions that said that people with intellectual disabilities who might be termed legally incompetent, the lower courts said if they were being, they had some elective surgery coming up, that even though they were, quote, legally incompetent, that the lower court said you should still talk to them about whether they might have a preference or a choice. You should work to communicate and find out if they had an opinion about this procedure that might be happening to them. And it's 3 women who are involved. And the DC Circuit, led by Kavanaugh, overturned this and basically said that if you were deemed legally incompetent, then you were incompetent. That communicating with you or looking for your opinion on whether or not you wanted these elective surgeries wasn't necessary. We thought that was a really clearly negative opinion for people with intellectual disabilities. And it's both the opinion and AUCD's statement are on our website. There are other places who have also come out against his nomination based on this in particular. But I wanted to draw it to your attention because it is a very specific disability opinion, and it is very specific about what he thinks of people with intellectual disabilities and their rights to, as my colleague Liz Weintraub would say, nothing about us without us. So that's a heads up for you, and you can go look that stuff up. WIOA, I always put this on here, no news yet. We're still waiting to hear if anybody, if they decide to open up those WIOA regulations. We hear that the decision has not been made yet at the department level, but we'll keep you updated. And RSA Commissioner, same thing. Mark Schultz has been nominated but nothing has happened. So for those of you who have asked me about that, nothing has happened. He's not been confirmed. So we are still waiting to hear. He is a former VR director from Nebraska. Okay, next slide. A couple of these are going to be real quick. This one, Department of Labor came out with their overarching 2017 labor force statistics, characteristics. This is all the stuff that Andrew and John always talk to you about. This is the department's 2017 summaries. I will leave that to John and Andrew. The only thing I would say is the second bullet point should say among 16 to 64-year-olds. I'm so sorry, 16 to 64-year-olds, not 20-year-olds. That's my typo. Next slide. The next thing is also kind of something that I will leave to Andrew and John. There is a new study by Purvi Sivak, John O'Neill, Andrew Houghtonville, and Deb Brucker on state and local determinants of employment outcomes among individuals with disabilities. They looked at the ACS survey. Their findings on associations are there. I will leave it to them to talk about it should you have questions. But I always think it's nice to highlight the work that's being done by the people who are, that we know and who are talking to you. So that's an important one, and the link is there in the title. Next one, next slide. This one is also referring back to somebody who spoke to us a couple of months ago. If you remember, Ellie Hartman from Promise, the Promise Projects, spoke with us about the work that they are doing in Wisconsin. Promise, as you'll recall, is a program co-sponsored by Social Security, Education, Labor, a variety of federal agencies, trying to see what happens if you surround kids who are on SSDI, if you surround them and their families with services. So everyone's always asking me when we're going to see data from Promise and when we're going to know more. The Maryland and Wisconsin process analysis reports by Mathematica are out. That's the first 2 of the 6. This looks at the first 3 years, and the links for those are also up above. We're beginning to see positive impacts. We're beginning to look at the challenges of delivering services to this population of transition-age youth with disabilities. That's not a surprise to most of the folks on this call, but I thought you would like to see that those first 2 are out. The next 4 are expected in the next few months. So that's another reminder of something we've talked about before. Okay, next slide. This is an interesting study I saw from the Journal of Vocational Rehabilitation. We've seen studies before that are on the relationships between employment and a variety of things. But there's very little out there, from what I understand, between employment and gender and living arrangements. And so this one I thought was interesting. Where are people living? Are they living together? Does living alone give you a higher odd of employment or lesser? Don't know why, but ultimately I think we need new studies on this one. That the amount of support needed to successfully participate in employment does seem to vary by gender and living arrangement. It's interesting that living alone seems to have higher odds of employment. Now that may simply be a statement about how many people with disabilities live alone versus are married. I don't know. I'm not the data geeks. You guys are, but I think it's an interesting one, and I'd be interested to hear what other people think about that one. Next slide. This one's from Australia. Again, this is something that we all talk about a lot here. This has to do with people with intellectual disabilities who have poor mental health. And so the juxtaposition between those 2 things, they analyzed pieces of legislation, which also from a policy geek angle, like me, I thought was fascinating, that they analyzed 37 pieces of mental health legislation and policy documents and looked at them to see how many of those, first of all, how many mentioned intellectual disability at all, and the answer is very few, or who had any specific strategies, and again, the answer is very few. And then how many of those could you look at? What strengths could you look at within the mental health legislation, and take some of the strengths from the mental health legislation and apply them to intellectual disability? And again, these are not surprising to folks on this call. The values-based, recognizing diversity, taking a life course approach, focusing on workforce development, all of those kinds of things. clearly those are things that we all know need to be included in intellectual disability legislation or legislation affecting people with intellectual disabilities. But clearly this is something that isn't necessarily happening in Australia, specific to intellectual disabilities, and could happen more. Again, from a policy geek point of view, I thought this one was an interesting one as well. Next slide, Andrew. So this is a couple things from nTIDE, the National Coordinating Center, the TA Center on Transition. They are going to be running a 2-week online dialogue with some specific experts online about pre-eds. And again, one of the things that I hear all the time are questions from states about pre-eds. What can we do? How can we do it? What's allowed? What's not? All kinds of issues around that. And I will say that it's not easy, and different states are doing it differently. However, this is 2 folks, one from Oregon, one from Oregon, and then one is a TI provider from nTIDE, both of whom are going to be talking about pre-eds and braiding funding and how you do it and how they're doing it in Oregon. And what they're open to in this 2-week online discussion are questions from you all about how they do it, how it works, why it works, how they've created it. So for those of you who have had questions that have been asking me questions about pre-eds, here's a place to ask some of your questions from some folks who are actually doing it from the VR space. Again, one state and how they're doing it in one state, which doesn't necessarily play to all states, but this is one example, and I thought it was interesting. I'll be watching it to see kind of where the dialogue goes. I think the last slide, Andrew, let's see. Yeah, another pre-employment transition one. And I've said before that one of the other things that I work on is inclusive post-secondary education for students with intellectual disabilities. So there is a webinar coming up that has to do with pre-employment transition services and inclusive higher education settings. It's a joint project of nTIDE, Think College, and the ROTC of VR Practices and Youth. It's coming up next week. I think it's going to be, again, a great place. There's been some discussion and even some disagreement perhaps about how pre-eds can be used for inclusive higher education. There is language that shows that it can be, and I am thrilled to see that they're going to be doing this webinar. I urge you to be on it. I'm certainly going to be on it. And I think that's all my slides, Andrew. Let's see. Yes, it is. So it is my pleasure to introduce our 2 guest speakers for today, both from Mathematica Policy Research, as Andrew mentioned earlier, Katie Morrison and Yanni Ben Shalom. Katie is a health analyst. She supports research on employment and health policy initiatives aimed at individuals with disabilities. She recently worked on a study examining the impact of $1 for $2 benefit offsets on the earnings of Social Security disability insurance beneficiaries. Katie has her master's in public policy from Georgetown. And then Yanni is a senior researcher. He specializes in policies and programs related to the employment and income of people with disabilities. In the past, he directed Stay-at-Home Return to Work, the Policy Collaborative. He currently serves as a principal investigator for several studies and has a PhD in economics from Johns Hopkins. So I am going to turn this over. I don't know who's first, but I figured they will figure that out. So I'm going to turn it over to Katie and Yanni. Thanks, everybody.
Hello. All right, so my name is Katie Morrison, and I work at Mathematica. I'm here with my colleague Yanni Ben Shalom, and we are going to present research that we conducted with another colleague of ours, Alex Goldworth, on employers' perspectives on accommodating and retaining employees with newly acquired disabilities. Next slide, please. So it's well established in the literature that millions of Americans per year lose jobs and leave the workforce because of new or existing disabilities. And when this happens, there are really a number of negative side effects. The individuals experience reduced income, employers suffer from reduced profits, the government loses taxes and ends up paying more in disability benefits and health care, So it's really a lose-lose situation. However, there is also robust evidence that when employers intervene early by either providing accommodations to employees or linking employees to resources that may be able to help them, they can really help retain these workers before they leave the workforce. Next slide, please. So this brings us to really our central research question that we addressed, which is which factors affect whether employers provide accommodations to and ultimately retain employees with newly acquired disabilities. Next slide. So to address this question, we conducted in-depth, semi-structured interviews with 14 employers in Arkansas. Our respondents were all human resources professionals. We recruited the employers through 3 different channels. 5 of our referrals were from the Arkansas Rehabilitation Services Agency. 8 referrals were from a professional society that we had reached out to, and 1 referral was from another employer who had participated in the study. During the interviews, we asked respondents to describe examples, or what we're calling cases, of times when employees at their organization either developed or disclosed new disabilities. To make sure we addressed our main research question, we explicitly asked them to focus on times when existing employees developed or disclosed a disability rather than soliciting examples from their hiring processes or times when they hired employees with disabilities. We asked employers really to describe these cases from start to finish, including how they first learned about the employee's disability or health condition, what types of steps were taken, and ultimately what the outcome was for the organization and the employee. In total, we heard about 50 cases, and these served really as our main unit of analysis for the study, and they enabled us to look at factors affecting accommodation both within and across the 14 employers. Just one note, we are going to give a few examples from these cases, but all of the details have really been anonymized so that they can't be traced back to the employers or any of the employees that we're talking about here. Next slide. So as you can see, there really was a great deal of variation in the example cases that employers described to us. Employees worked in a variety of industries ranging from finance to manufacturing. Their occupations ranged from assembly worker to senior manager. The employees reported, they had a variety of different health conditions ranging from cancer to schizophrenia to carpal tunnel syndrome. And ultimately, some of these employees were successfully accommodated and were able to stay at work, whereas other employees left because of their disability or were terminated by the employer in some cases. Next slide. So what were the findings? We found that really a number of factors affected employers' actions when employees developed or disclosed a disability, and we grouped those into 3 levels: societal factors, employer factors, and employee factors, and I'll describe all of these in more detail. So next slide. So starting with the society level factors, next slide again.
Oh, sorry.
Oh, no problem. So starting with the society level factors, our main finding was that publicly available resources that are easy to access and free to use were greatly appreciated by employers. Employers received valuable information and resources from programs like the Department of Labor's Job Assistance Network and the Arkansas Vocational Rehabilitation Agency's Stay at Work, Return to Work program. For those that are not familiar, the Stay at Work, Return to Work program in Arkansas provides employers with assistance in providing accommodations. Although a few other states are starting to adopt similar programs, the Stay at Work, Return to Work program is pretty unique in that it's one of the programs that really target employers. So some of the things that we heard from our respondents were, first of all, that they really appreciated that these services were free and easy to use. So for example, we heard from one HR director that said it was very convenient for the Stay at Work, Return to Work representative to come in and provide assistance for us, and as a free service too. Employers also reported that they appreciated really the expert guidance on identifying appropriate accommodations and in some cases procuring equipment for employees. So we heard from another employer in the study that said, I'm not an expert on hearing. There would be no way that I could even say, oh, we need to get you hearing aids. I don't have any clue at all. But because of the assistance from the representatives through the Stay at Work, Return to Work program, these employers were able to identify and make these accommodations for these employees. Next slide. Great. So next I'm going to talk more about some of the employer level factors that appeared to affect accommodation and retention, starting with employers' resources, such as financial resources, staff capacity, and other private resources like temporary workers, float pools, and employee assistance programs. And what we heard here, not surprisingly, was that having more of these resources really made it a lot easier for employers to provide accommodations to employees. Employers repeatedly noted really just how time-consuming, how resource-intensive, and in some cases, like expensive it can be to accommodate employees. So for example, we heard from one HR director who described a case where an employee developed a cognitive disability. And the HR director said, we probably spent at least a year working to accommodate the individual despite the frustrations and the hardships and all the extra manpower that was required. And this respondent really emphasized that, accommodations can take a lot of time and energy, so having more of these resources really does help make it easier for employers. Next slide. Another theme that we heard was that it's really essential that the employer be able to communicate effectively and collect information from a variety of stakeholders. And these stakeholders can include, obviously, the employee, other human resources staff, the employee's supervisors or direct managers, their medical providers, insurance providers. Next slide. So to give an example of this, one of the respondents that we spoke to really just described the variety of stakeholders that were involved in accommodating an employee with an anxiety disorder. And the human resources professional told us the employee cited that he had an anxiety disorder, and he presented documentation to the human resources group from a healthcare provider. We had to convey to him the company's position from the standpoint of the expectation for him to be able to do certain things. We can't just take certain functions off your plate, but we can modify your work hours and maybe modify the number of supervisees that you're responsible for. We engaged with his managers after we discussed the issues with him. So in this case, the employer was able to facilitate communication with all of these stakeholders who are highlighted in red on the slide, and the employee was successfully retained. But what we really heard from other employers in the study, from hearing about other cases, was that when the employer wasn't able to have this kind of clear communication with all of the stakeholders, it was just a lot, or whenever this communication kind of broke down, it was a lot more challenging for employers to be able to identify and provide accommodations to employees. Next slide. So the third level of factors that appeared to affect accommodation and retention were these employee level factors. And those are things like tenure, work performance, type of health problem. And what we found was that these employee level factors really did make a difference in employers' efforts to accommodate and retain workers with disabilities. So starting with tenure, what we found was that employees who had worked at their organization for 4 or more years were really more likely to be retained than those with shorter tenure, primarily because employers felt like they owed it to the employees that had been there for a long time, or in some cases they mentioned that they really didn't want to get a bad reputation as an employer who doesn't help long-time employees. So for example, we did hear about one case where an employee had developed a back problem only about 2 weeks after starting a job, and the employee was not able to even come into work. What we heard from the HR director that we interviewed was the individual hadn't been with the company very long. That's typically when you're going to see retention not working out, because you don't feel compelled to have to offer as much as you would to somebody who put in more time with the organization. So in this case, the employer actually did end up terminating the individual, and from what we heard, it did sound like their short tenure did kind of contribute to that ultimate outcome. Next slide. So in addition, employee work performance, I guess prior to onset of a disability also appeared to affect employer efforts to accommodate and retain workers. So of the 14 employers that we talked to, 6 of them explicitly said that good work performance was a factor that incentivized them to really make more of an effort to accommodate workers. So if you go to the next slide, we have an example of this where we heard an individual, the HR manager said that the employee had been at the organization for about 2 months and then got in a very severe car accident that required multiple surgeries and extensive time out of the office. And what the HR manager told us during the interview was that right after this accident happened, the employee's direct manager came to HR and said, you know, I know that that they don't qualify for FMLA. However, what I've seen in 2 months is the type of employee I want. Whatever it takes, I want them back. So ultimately, the employee was able to take leave, and then after their surgeries, after they were able to start returning to work, the employee was granted a flexible schedule and was able to ease back into work. So in this case, you know, that strong performance during the employee's limited tenure seems to have facilitated accommodation. Next slide. So another factor that we heard about was really the type of work that employees were engaged in. When cases involved employees in really active, more physically demanding roles, employers seemed to have a harder time identifying really ways to keep the employee at work, either, you know, because their disabilities were just more likely to stop them from performing core functions of their job. So we heard about this one case where a nurse whose role required being up and moving about all day developed a back problem that made it impossible for him to really be on his feet all day. And the director of HR, when describing this case, said, you know, I just felt like my hands were tied. So they granted the employee leave, but they didn't really know how else to modify the job for the employee, and ultimately the employee was terminated. Next slide. A final employee level characteristic that, you know, we saw emerging was the type of health problem, the type of disability that the employee was experiencing. So musculoskeletal conditions and other conditions that could be addressed with ergonomic adjustments were really, well, first of all, they seem to be more common, but they also, the HR respondents that we talked to described them as a little bit easier to actually to provide those accommodations. In contrast, what we heard was that mental and behavioral health conditions, worsening conditions, things like terminal illnesses, and conditions that really hindered employees' ability to perform basic activities of daily living were much more challenging for employers to accommodate. Next slide. So we heard several examples that were about mental and behavioral health conditions, and one of the quotes that we heard from an HR manager really described some of the challenges that they saw in retaining employees with mental and behavioral health conditions. The HR manager said it's almost impossible to retain employees with mental and behavioral health conditions because I think they don't expect their employer to be acting in their best interest. So when we call to find out how they are doing, they're really suspicious. It is really difficult to get information back. So this idea of, like, I guess, more challenging communication between employers and employees with these types of conditions was echoed by other employers, and some of them speculated that this I guess, breakdown in communication was in part because of stigma, fear of discrimination, or just because the employees didn't really know that accommodations could even be provided for their disabilities. So if you go to the next slide, please. So what are some of the implications of this research? First, bolstering employer resources and improving the flow of information really could help employers accommodate employees with disabilities. For example, by providing more resources like the Stay at Work, Return to Work program, or, you know, some more types of like case management services to improve communication between employees with disabilities, employers, and other stakeholders. Second, I think a key takeaway was that when early intervention requires employer involvement, it's really important to take employee characteristics into account and acknowledge that employers may treat employees differently. So, we know that a lot of interventions designed to keep employees with disabilities at work are delivered by the employer or use the employer to link employees to accommodations or services. So based on our findings, I think it's really important that to note that maybe we should not expect employers to make equal efforts to connect all employees who would benefit from these resources to these resources and services. So for example, our findings suggest that maybe employers might be more proactive in linking workers to services if they have longer tenure or stronger perceived work performance. So because of this, policymakers really, should think about how to connect services to a broad range of employees, including those with short tenure, perceived low performance, more physically active or demanding roles, and medical conditions that maybe are sometimes more challenging to accommodate from the employer perspective. As we discussed at the outset of this presentation, these workers in society both benefit if they're able to stay at work, even if it's not necessarily in an employer's, even if, it's not an employer's first instinct, to go the extra mile to accommodate and retain these workers. So that's all I think we have for our presentation. I guess it's time to open it up to questions.
That's right. So it's Q&A time. So people can ask questions by filling out the Q&A box there. While we're waiting for people to kind of develop their questions for you, Denise, there was a question for you about how much, did you see it?
Yeah, I did see it. So thank you for the question. There was a question about the Heads Up Act, which is the Healthcare Extension and Accessibility for Developmentally Disabled and Underserved Populations Act. We love our acronyms, but it adds up to Heads Up. I actually don't know a lot about it. It was just introduced the end of July, the 27th, 28th, somewhere, as part of the ADA anniversary. Basically what it does is, and what I'll do is promise you that I'll raise it again next month when I know some more, but what it does, it was introduced by Representative Seth Moulton of Massachusetts and Greg Harper of Mississippi, and with work from the National Council on Disability. So NCD was really involved with it, which is always a good sign for disability legislation. And what it does is as I understand it at least, it designates people with intellectual and developmental disabilities as a medically underserved population under the Health Services and Resources Administration, HRSA. So what that would mean is it gives access to loan repayment, training programs to those who are providing care. I mean, the issue that they're looking at is the health disparities with individuals with intellectual and developmental disabilities and the challenge that folks with IDD face in finding providers, and providers who know what they're doing and are properly trained and understand how to treat folks with intellectual and developmental disabilities. So what it does is provide, as I understand it, along with other typically medically underserved populations as defined by HRSA, it puts us, that population, in there. And what I'm seeing, at least, and I have to admit to have done a quick, when I saw the question, to do a quick web search to see if I could get anything else, more than the basics that I knew, that it would allow access to loan repayment and training programs, some incentives for providers who serve people with IDD, like a higher CMS reimbursement for provider services in certain areas where there are shortages. I think from what I can see, and I have not done analysis, so I'm going to have to do that. So I'll do that and report back next month. But from what I can see, and certainly the fact that the National Council on Disability is supporting it and helped to write it, it looks like a really good idea to help address some of the shortages that we see in providers, and specifically medical providers. So I will do more and get back to you, but I really appreciate the question because it wasn't something that I've looked into a lot. My guess is, particularly since it was just introduced, that it's not going anywhere particularly, but I will find that out before next month. So thank you very much for the question. I also, while I've got the stage for a second, Andrew, I would say that a couple of people have posted, there's one, the link to sign up for the Inclusive Higher Education PREETs and Inclusive Higher Ed webinar was stuck into the Q&A box. Thank you very much for that. And I think the question on the link, one of the other links is up there as well. Oh, the link, someone asked for the link to the case by Judge Kavanaugh. And Megan, thank you, put up the link to the AUCD statement, which includes the link to the case. And we'd be more than happy to answer other questions on that. You can also go up to the aucd.org website and it's up there. So thanks, Andrew.
Thank you. So let's see the Q&A box. I have a ton of questions of my own, but we'll stick with the Q&A box. I don't know, Katie and Yanni, can you see the Q&A box?
Yeah, and let me take on the first question about somebody's asking if Arkansas is a right-to-work state and if that was an issue in providing disability supports. And I have to say, I don't know off the top of my head if it is a right-to-work state, and I believe right-to-work has to do with, you know, whether somebody can be forced to pay dues to a union. I hope I got that right. As far as I know, Katie, unions didn't come up really. We didn't have a question about that built into our questionnaires, but we also don't recall any issues related to unions coming up.
Yeah, so right to work has that's one provision that you don't have to, you're not forced to pay dues, but many right to work states also have where you an employer can fire a person without cause. As long as discrimination is not involved.
Yeah, and I don't know if that came up.
It didn't come up organically, no.
But yeah, all the employers were in Arkansas, you know, so we didn't have variation across employers in that regard. But that is an interesting question. That'll be interesting to explore. I'll go to the next question. Someone asked about the type of what types of statistics or research can you send me to answer this question? Why retain workers and accommodate? Basically, what I would like to have is information to persuade employers to reach out and accommodate the employees. That's a very good question, and you know, it's a complicated one. That the reasons vary from one employer to the next, and based on the type of industry and the type of work the workers are doing, but also the package of benefits that is provided to workers. I can point out a few years back, I think there was a report, I think it came out from the National Governors Association. It was called The Better Bottom Line. And I think really laid out a lot of, you know, the research and statistics explaining why it's good for the employer's bottom line. We, as part of our projects for ODEP, looked at the cost-benefit implications of helping people stay at work. And then we did that from multiple perspectives: the employer, the federal government, and the state government. And to be truthful, from the employer perspective, it's a challenge. You know, if you provide, you know, disability insurance benefits to the employee, or if this is a workers' compensation case where the employer is liable for compensation, then the cost is obvious. If it's a worker, high-skilled worker that the employer has invested in, and you know, it takes a lot of time to find a replacement for and to onboard to the company, that's another factor. On the other hand, I think we can't hide the fact that after, depending on the condition and disability, and how long it takes to you know, come back to full function, there will be a loss of productivity that affects the employer. And depending on the state of the economy, the local and nationally, it may be harder or easier to replace a worker. So I have to say I don't have a clear-cut answer of you know, where those statistics are, but I think check out the Better Bottom Line report. And there's some other resources out there that I can't think of right now, but I know that have looked at the cost to employers of illnesses and injuries to their employees. Just for the sake of answering the earlier question, somebody confirmed that Arkansas is a right to work state.
Let me add in, there are a couple of things that ODEP, I would send somebody who wants to go find the research and some of that information on employers and to check out some of the other ODEP resources. The LEAD Center, which is www.leadcenter, LEADCENTER.org, may have some of that. The JAM, the Job Accommodation Network, may have some of that. So I recommend going and looking at some of the other ODEP resources that are out there. The other thing is, let's make sure that, since no one said it yet, I will, that we remember that the Americans with Disabilities Act does cover employment and does require certain reasonable accommodations as a civil right. So there are, I understand that that doesn't answer all of the questions, but let's make sure that we remember that that's part of the conversation that we're talking about here.
I'd like to add the fact, this is John, that there is a survey of about 6,000 supervisors from across the country that the University of New Hampshire and the Kessler Foundation just completed. And we're working on the results. The top line results are on the Kessler Foundation website, and there's quite a bit of information about accommodations and the support that organizations provide. So it's a nice resource.
This is Andrew. So I have a question for Katie and Yanni. So it was interesting to see that there was, with regard to mental conditions, there was a lot of concern or fear. And it seemed to be on the part of the individual, that the individual was fearful that the company. Did you see it go the other way around? One of the things that I believe it was research that the ICI Boston had been doing showed that with unobservable conditions, similar, such as mental conditions or maybe even lower back, there's a certain degree, the non-visibility of a condition, that there was a certain degree of distrust and also a concern, particularly with mental conditions, about how to communicate effectively with the employee. Did you see any of the kind of concerns or fears come from the employer? Because that could be one way of that your first point about services and having connections to people who are trained in providing, in creating accommodations and retaining people with disabilities, a third party on board would be to smooth that kind of fear of, am I communicating correctly? Am I calling the condition correctly? Am I using the right words? Because I think that that's a concern of many people, is that they make sure that they do things fairly and properly. I guess that was a question. I'm not sure.
I think the answer to that question is that yes, we did see that to some extent. That that it sounded like employers that we talked to were aware that they just sensed that employees were not being necessarily forthcoming with some of their unobservable conditions, but there was also a sense on their side that I guess we didn't explicitly hear, I don't know how to talk to people about their mental health conditions. That didn't quite come out that clearly, but there was a sense that when it comes to things that they couldn't see, how could they train supervisors to be, more aware of those types of conditions, or be able to talk to employees about them a little bit earlier on or more openly. So I think we saw some of that.
Okay. There's another question about whether how many people acquired while while working. I would also kind of extend that. It was a question that I had, is what percentage may have been involved in a workers' comp claim? You don't necessarily have, not all disabilities that you acquire while working are workers' comp claims, but did you see, could you just respond to that question as well?
Yeah, I think I want to say like 2 of the 50 cases were acquired on the job. Don't quote me on that, but it was a small percentage of the 50 cases.
But they all were working at the time that it was acquired?
Yes, exactly. They were, yeah, yes, exactly. So all of I think, yes, almost all of them were acquired while they were working.
But only those 2 were under workers' compensation.
Right.
Right. Okay.
Yeah, and I think
I have a question related to the degree to which you got a sense as to the added value that the state vocational rehabilitation program provided.
Yeah, let me just wrap up what Andy was asking about, or the other question about workers' comp. I just want to emphasize, that there's a lot of visibility around workers' compensation because everybody virtually is covered, and there's a lot of claims going on workers' compensation, and depending on the state and situation, a lot of litigation. But I think it's important to recognize that our sample is not random, but most of the people who acquire a disability while working, the work is not in any way at fault. It happens at home, on the road, or wherever. And it's important to understand that we have a lot more information about workers' compensation because there's a claim and the cases are managed, and they also pay for the medical care. So there's a lot of information we can glean from, at least data-wise, on those cases, whereas we know much less about those other cases, because there is no claim, or that the health care is provided separately from short-term disability. So there's a lot less information on that population, although most of the people who, develop a work disability are not, those are not occupational cases, so to speak.
Right.
Yeah, so John, your question was about the value added of the service. Katie, maybe you want to start. And there were some quotes, I think, that made it clear how valuable they were. I'll let Katie add some more, but I will say that a state like Arkansas, first of all, they have limited capacity to go out to a lot of employers, and when they do, the employers are very appreciative of it. But if we're talking about numbers, Arkansas maybe provides these services to 200 workers per year. The number of people who end up applying for SSDI in a state like Arkansas is in the tens of thousands. So it's really a drop in the bucket, and I think one of the challenges is to figure out how can these sort of services be provided on a much larger extent. But Andy, do you want to add anything specifically about what employers were saying?
Yeah, I don't have much to add other than that it seemed like it was very valuable to them to have these free and easily accessible resources. Everybody that used them really spoke very highly of them and said that it made a big difference in, the timeliness of them being able to address workers' needs, and also just like their ability to identify how to address workers' needs.
Sounds good. Well, we're almost out of time. Let's check the Q&A box one last time. Looks like here comes the last one. Do you have any other states, do any other states have similar stay at work, return to work policies?
Yeah, that's a great question. So we know that Alabama had a unit also in their VR agency. It's called RAVE, I believe, retaining a valued employee. Last I checked, it was really hard to find information about them. So I know that they have been active and looking for ways to increase their activity. I don't know if anything has changed recently in that regard. It's been a while since we've been in touch with them. We know there were a couple other southern states, I think maybe Georgia and Southern Carolina, that did have similar units that we don't know much about. I did want to mention that WIOA opened the door a bit for VR agencies to, serve people who are already working. So, as time goes by after we might see more states electing to do that. I did see on Florida's website that they said that they would start looking into options for doing that, but I think it will take them a while to ramp up. It might be interesting to see what other states are doing in this field.
Sounds good. Okay, great. Well, we're at the end of our time. We do have, let's see what we have. We have some references from you guys that you did and some contact information. So if people are interested in contacting Katie, here's her contact information. Again, this stuff is all posted on our website. We also have a survey that you could take. And with that, I'd like to thank everybody for participating, and we'll see you next month. Bye-bye.